Welcome everyone. I'm Councillor Matthew Winnington, Cabinet Member for Community Wellbeing, Health and Care. If the continuous fire alarm sounds, please evacuate the room. Public galleries, no one in the public gallery today. By the stairwells, do not attempt to use the lifts. Please assemble by Queen Victoria's statue. I don't think anyone would have signed in, so that's fine. Members of press and public are also permitted to record, but there are no press and public. Please go and use the microphones and remember to switch them off when they are finished. So start instructions from my left.
Anna Martin, Democratic Services.
Andy Biddle, Director of Adult Social Care.
Emma Baxter, Finance Manager.
Councillor Graham Heaney, Labour spokesman for Community Wellbeing, Health and Care.
Hello Chair, Matthew Cordy, Member for Hilsey.
Spencer Gardner, Member for Drayton and Farlington.
Thank you very much everyone. We have no deputations today. Members and no apologies, which is great. Any declarations of interest, colleagues? No? Fantastic. So without further ado, on to item 3, assisted transport policy. Andy, over to you.
Thank you, Chair. So the paper in front of you in sections 1 and 2, we've highlighted that this follows the implementation of the equitable assisted transport policy as agreed at the portfolio meeting on the 4th of November of last year. And if the recommendations are approved today by Cabinet Member, an appendix to that policy will be created to deal with charging for transport. So the text within the report will be the foundation of that appendix. The recommendations set out intend to continue the theme of equity in the policy and relate specifically to charging and align with the City Council principle of full cost recovery for external bodies. The report also aligns with the Adult Social Care Strategy, which was published in the summer last year, which governs all of the work of adult social care in Portsmouth. So in section 3, this section sets out the background for current charging arrangements and gives some comparison with other local authorities who charge for transport. In section 4, it reminds us of the legislative basis for charging for social care in England and the restrictions around any profit to be made from charging for social care. In section 5, the options considered in making the recommendation in the paper to the Cabinet Member and also setting out the rationale for discounting those options where appropriate. And in section 6, we set out the implementation of the charging regime if approved. For charging residents, July 2025, we would intend to implement, and for other bodies from April 2025. That section also sets out the intention to develop guidance around the risk of withdrawing from support in response to charging. We have some finance and legal comments about the policy in section 7 and 8. And then in section 9, the emphasis that the introduction of this part of the policy is intended to provide equity for any residents concerned. That's a summary of the report that's before you, but of course happy to take any questions.
Thank you very much, Andy. Colleagues, any comments or questions? Matt?
Oh, thank you, Chair. So it mentions that this is to introduce a full cost recovery model. Would the £5 per journey actually cover all of the costs?
There's a slight difference. So the full cost recovery would be aimed at those external funding bodies. So if we're providing services for external bodies, we'd aim full cost recovery there. But for our residents, we understand that it's difficult to pay the full cost of transport, so the £5 would in effect be a single charge.
Thank you, Matt. Any other comments, questions? Graham?
Yeah, just to follow up on that, the report says the charge is yet to be determined, is likely to be in the region of £5 per journey, single return. So can I ask what is going to determine what the actual charge is, and are we near a decision on what that should be?
So what we said in the paper, the reason that we've given ourselves to July is to work out if that's fair and reasonable. We need to do some work around that which we're not quite clear about at the moment. We're taking some advice from colleagues internally around VAT. So we put the £5 charge there as what we think it's likely to be, and we hope that won't change. But those sort of figurings, those workings out, may bring a change. What we'd intend to do is, if this is approved today, is bring either an MIS or, if necessary, an appendix back to this meeting. But we think it's in the region of £5.
Anything else? Spencer? Anything for you? Thanks, Andy, and thanks, colleagues, for your questions. As Andy said, this is a follow-on from the decision made in November that we would move forward with a policy for funding. As I mentioned then, this is something that we'd historically absorbed within our costs for adult social care, but it's got to the point whereby we need to be looking at getting some revenue from it. And also it's becoming increasingly obvious that there are some people who get funding to get mobility support who are not using it for transport and effectively therefore getting transport free when they should be using that. But there's also other people who aren't using our transport at all, who should be getting it for free but aren't making use of it. So this is a better way of making sure that everyone has that opportunity. Andy, just a query. In terms of, we've got this, obviously this rate which would be flat around £5. Can you just clarify whether that would be for single or return journeys, and what would happen if someone said that that was an issue and would stop them using the transport?
I mean, what we've put in the paper, we haven't differentiated single or return journeys, but we'd probably need to clarify that. But I would say that's going to be for return journeys for us currently. If in the same way as when we're working through charging for care services, if we believe, and if someone's representing to us, if a resident or their family is representing to us that the only reason they wouldn't use care services is for charging, then we want to do some work with that individual. So we'd want to investigate that further. We want to understand the risk to that person. I don't think in Portsmouth we've ever been in the position that we've withdrawn services on the basis of charging. But we'd want to do some individual work with that person and their representatives or advocates. It's very much based on risk to that person, I would say. We wouldn't, as I say, we wouldn't want to see people denied services, but we are entitled to make a charge through the legislation.
Thank you. And I know, because it came up when we discussed this yesterday, we were asking the question because it wasn't entirely clear about Southampton's charge, whether it's £5 for a single or return journey. And I believe you have a little bit more information on that.
We do. So the Southampton have made a temporary arrangement of £5, and they've talked about that as they haven't specified on a single or return journey. They've just said it's a temporary arrangement. And there was another phrase that I can't quite call to mind at the moment, but it was whilst there are other calculations ongoing, we don't quite know what that means. That was from the published public documents.
I think that just came up to you think, oh, what are Southampton doing as there are close unitary neighbours? So I think whatever the outcome of this is, I think we've got a more clear policy than Southampton has, which is good. And then so I think the other thing to say, and this touches on Matt's points about full cost recovery, and when Andy's talking about other statutory bodies, that would tend to be almost entirely be the NHS. And again, just for anyone watching, you might think, why are you putting full cost onto the NHS? If people are being funded by the NHS, then that should be entirely paid by the NHS anyway. And if we don't charge full cost, we are effectively subsidising the NHS, who don't need subsidising because that person should be getting the full cost of their care from the NHS. So that's why we've got that in there. So another statutory body really should be paying the full amount. And in this case, it is almost always the NHS. And if you're due that care, it's free. It's free at the point of delivery completely. So that would be why it's full cost recovery. Whereas for residents, it's a case of we've come up with this fair, and through conversation as well, that doing this is equitable because it sets a standard charge which is pretty standard across the country, and we have some quite interesting stats here of the fact that around £5 is quite reasonable, and I brought this up at the pre-meet. I wouldn't want to be in Cumberland or Westmoreland and Furness, bearing in mind they're big rural counties and they charge £1.85 a mile. So you can imagine some of the distances involved in some of those journeys and how much that costs individuals. So I think we've got that right, and of course, if we are having a lot of comeback, we can always look at it again. But I think looking at for the appendix, for anyone interested, it's online, it's in the papers. It's quite a reasonable price, I think. And as Andy said, I'm reassured by the fact that we've got things in place where we would do that on a case by case if someone said I really would struggle to pay that. So as such, I am happy to go with the recommendations, and so that would be, so I'll read out the recommendation and just clarify. So the recommendation is that I'm agreeing to is the development of a charging policy framework to charge a flat rate for assisted transport for residents who cannot meet their own transport needs and have no other means of accessing a service without transport being provided, arranged by the council, ensuring the residents are treated equitably. And then within the paper, that is, let me just get it right, that is option 2. So that will be, so again, if people are looking at the papers, then that's option 2. And then recommendation 2, the move from the existing practice of recharging a subsidised rate to external bodies funding ports of residents to attend in-house day services and introduce the full cost recovery model, which is what we just discussed there, about making sure that we're not effectively subsidising something that should be free for that person and should be fully funded by the NHS. So I'm happy to take both of those recommendations. So we move on to item 4, Adult Care and Support Accommodation Strategy 2024 to 2034. Back to you, Andy.
Thank you, Chair. So the paper in front of you, as part of our adult social care strategy around care and support, this is part, of our adult social care strategy around care and support. And the reports in sections 1, 2 and 3 set out a summary of the accommodation strategy for residents over the age of 18 who have care and support needs. Section 3 in particular sets out which residents this applies to with more detailed background of the local context and the current provision that we have in Portsmouth of accommodation. Section 3.4 gives some greater detail around each type of accommodation, running through sheltered housing, extra care, shared lives, residential and nursing care, and that section also highlights the numbers of each type of accommodation that we believe are going to be needed in future years for our residents. Section 3.5 sets out a number of actions within the strategy to address the challenges that we've set out and the deficits in numbers that we've got at the moment that are identified in the report. We've included a copy of the strategy as an appendix for further information, and I'd like to express my gratitude to Lynn Churches for working on this strategy. It represents work that we've wanted to do for some time but haven't had the capacity to do that, and I'm hopeful that this will begin to form our priorities for developing accommodation with care and support in Portsmouth. It's a really fundamental part of trying to plan in the long term for those things that our residents will need and look ahead more than the immediate year. Oftentimes our budget allocation drives us to look year by year, but we want to take a far longer term view and ensure that we're having the right discussions and hopefully ensuring that we have the right building going on in the city to support residents' care and support needs. That's a summary of the paper, but happy to take any questions.
Thank you, Andy. Any comments, questions, colleagues? Graham.
A couple of questions. On page 28 of the actual strategy. It mentions that in paragraph 6.5 it is a surplus of 928 affordable sheltered housing units. There is a footnote 6, but the footnote 6 doesn't appear on the bottom of the page, so I wasn't quite sure where that came from. Is the question of surplus due to the accommodation not being suitable as sheltered accommodation because it doesn't meet standards? How come we've got that surplus?
It's an odd situation in the city, so that we have more accommodation than we need because of the way we use it. We do have some hard-to-let units within the city. We may well need to think about refurbishment of these units, thinking about how we're using accommodation earlier for people so that they, before they develop stronger needs for care and support, we're helping them move into that accommodation earlier. We do have a surplus. We are working very closely with our housing, neighbourhood and buildings colleagues to make sure that we've got the right people in the right type of accommodation, because at the moment we don't have a surplus in extra care. And we are working with people with quite significant needs in our extra care accommodation, so the balance is sometimes a little off. Whereas if we could spread those needs across all our types of accommodation, I think we can make better use of it. So I think that's what that refers to in the strategy. But I can get you a more detailed explanation of that in discussion with Lynn.
It was interesting because many years ago when I was chair of housing, we had an issue with what we call bedsit flats, which we couldn't get allocated for single people, and particularly single people who maybe wanted sheltered accommodation because it was just not what they wanted. I don't know, it's a drafting issue, but there is a footnote there on that 6, but the footnote doesn't appear, which is why I was hoping to find the thing. But I'm happy to receive some information about that later. The other one I wanted to ask about was on page 32 of the report, of the strategy, and it talks about the balance of needs within extra care housing, and it sort of sets out the issues about uneven split, struggling to attract low needs residents, need a proportion of low needs residents but not have too many of them. Do you sort of work on a proportion of lower needs residents as a sort of an ideal, try to get within a certain range of maybe a third or whatever? How does that work?
We do. There's some fairly established national research around how you have a balance of needs within extra care accommodation, so that you can provide the right level of care, the right level of on-call care, and still have a community feel. Because I guess if we end up providing for too many people that have a higher level of needs, then you can start to almost wander into care home territory rather than have an active community. So we do take note of the delineation that we see nationally. I don't think that to this point we've been able to get that right balance in all of our extra care accommodation, so it's something we want to do in terms of our recommissioning plans, both for the care and support that we've got in our existing extra care accommodation and in future builds. So I think we've got a balance. I don't think it's the right balance, so sometimes we have too many people with too high needs. So we've got some work to do around that.
And I remember when I was Cosham Council, I used to go to Arthur Down Court, and there was always a good community atmosphere there, because there were people obviously who needed higher care needs, but there was a great sense of camaraderie, and people would be in the communal areas doing stuff, and it was always great to go and visit that. And so I can see the importance of making that sharing thing, because I think people who have higher care needs, if they feel they're in an environment where there's lots of other people, it can make them feel a bit sort of isolated and maybe less, not quite so happy. So quite important. I think they were the only real questions I had. I mean, the strategy is obviously quite comprehensive, and there's quite a lot of challenging issues to deal with. So.
If I could just come back on that, Chair, that's absolutely right. And I think when we designed the offer for extra care that we have currently, so the 4 main blocks, we didn't design in the community support, because whilst a community will support itself and will develop and flourish itself, you often need some encouragement, a spark, some facilitation. And so I think it's something we're very aware of. We've since, in those 4 blocks that we have now, we've since put in some community connector time, and we're supporting the company that provides the care and support there to provide a bit more of that with our residents. But we're fully aware of that again as well in new developments, and that's something we need to put in as a standard, if you like, how much community development enables exactly that which you described to happen in all of those blocks, because it's really important, that community cohesion piece. Thank you, Chair.
There's a couple of questions about the existing providers, which I'll leave to separately because not really part of the accommodation strategy. I'll come back to you on that. I noticed that, and I'll drop you an email about that one.
Any other comments or questions? Thanks, Andy. Thanks, Graham, for your contribution there. This has been a priority for this administration for nearly 7 years, and we were working quite extensively on it before the pandemic in 2020, and then everything changed, and a lot of those assumptions that were made back in 2020 have changed because effectively the landscape of care and care needs has changed since then. It's one of those things that's that has happened right across the country. So ways that you look at care, ways you look at supports. During the pandemic, we had things like discharge units, and we still have our discharge unit in Portsmouth. Lots of other places haven't, but that did change the way that we looked at how we care for our residents, how we give them the right accommodation at the right time in their lives. So I'm really pleased that we've had Lynn in to do this work. As Andy said, it has been difficult to bring everything together because obviously there's been constant squeeze on resources. So having Lynn in is to not just do capacity building in this area, but also around commissioning it, etc., has been really critical. And the better we have this, the more it will save us money as a council in the future. Of course, we also don't know what the future holds for the council. I hope that there is hands off Portsmouth and we have Portsmouth remaining as we are. But if we are moving on to, if we are going to have to expand and take in other neighbouring areas, the accommodation for what we need in Portsmouth as it is at the moment is also really important, because that will be really important to understand the demographics and the needs within the city as it is now. So I'm really pleased with this. And I think it's worth explaining as well that this really gives the opportunity for the council and partners to know where they need to go in terms of what we need to build as a council, what developers who are coming in who build for older people, what kind of accommodation they can provide, but also more general developers, if they're developing in parts of the city where they want to do a mixed development, about maybe how many houses and flats you might want to be fully adaptable. Because it's not necessarily something that you can do for every home, but if you make, the more homes you have that are adaptable, the better, and that gives a real pointer that for developers, that they say, oh well, we know that this is going to be the need in the future, so therefore this is what the adaptability is. But also about thinking about mixed communities as well, and we've talked a lot about that, and we know a really great example of this was Somerstown when they did their what's now the Summers Orchards developments, where the 2 towers were. When that went through, you asked the community, and the community said, we want a mixed community of like family homes, but we also want the ability to have in there accommodation for older people, supported housing, extra care, etc., etc. So it was a real, and they said, you know, perhaps even a care home, and so that really does have that. We know in our communities people are happy and they think that's a good thing. So that really helps us with having this as a basis, so that when we're talking across, and I know Andy will be, you know, this is something that is then available for housing, working very closely with the housing on this, but also other parts of the city, so economic development and regeneration, that we can really look at this and say, this is what we need. If someone comes in from outside saying, oh, we want to develop this site, said, right, have a look at this, would you be able to do that as part of a development? Because there is going to be there's going to be need for it, so therefore it's going to be worth building, worth your while. Whereas it's not having the strategy has meant we haven't been able to have that basis. So it's very much like sort of the local plan in those terms as well, and it fits in with that completely. So very pleased it's here. It goes forward for 9 years from now, and that is a time where we will get increasing pressure on our system, but the more and better supported housing, extra care accommodation that's adaptable, the better it's going to be for the city, for the people who live here, but also for our finances, because the more people are in the right accommodation who can be more independent in their living for as long as they possibly can be, which is right for them, the better. And it stops us having to do more expensive placements that aren't appropriate for people at the time of their lives that they have. So really pleased with this. Thanks so much for Lynn and everyone who's been involved with it, and thanks for Andy for pushing forward with this, and we've got something now I think we can really use in a really positive way going right forwards for the next decade. So happy to note that report. And finally, item 5, equality, diversity, inclusion work in adult social care. Andy, sorry, back to you.
Thank you, Chair. So the information report, as always, is a result of our adult social care strategy and our subsequent improvement plan. In section 4, we set out the legislative basis for policies covering equality and diversity and the expectation of the regulator. As you know, we will be inspected at some stage this calendar year by the Care Quality Commission, and they'll be looking to our activity in this area. Section 4.2 sets out the potential wellbeing impact of implementing a strategy. Section 5 sets out some of the areas of work being undertaken currently in adult social care to ensure that we're considering the needs of our residents and of our workforce. In addition to having regard to the Portsmouth City Council strategy, we're working on the social care workforce race equality standard, diverse by design, and combating discriminatory abuse. In common with our assisted transport policy, this work aims to ensure that we're achieving equity in supporting our population and supporting our workforce. So that's a broad summary of the paper, but happy to take any questions, comments.
Thanks, Andy. Any comments or questions? No? Oh, so that's nice and straightforward. Thanks, Andy, and thanks for Vernon for his work on this. It's an important thing, and I mentioned at our briefing. I think obviously EDI or DEI, as they call it in America, it's been in the news a lot. But I think it's worth reiterating that this is a much broader thing than just ethnic background, etc. This is about people's needs as individuals. So that could be their disability, that could be their age, that can be a huge amount of different things, effectively looking at them as individuals. And that's obviously for adult social care in particular, that is absolutely critical for making sure that we are taking into account everyone's needs individually and exactly what they need. So having this is important, and as Andy said, I think it's we know we're going to be inspected this year. That is going to happen, and it's really important that we have that as part of our evidence base to make sure that we are meeting the needs of everyone in the city who needs to use adult social care, and also who may need to use adult social care in the future, especially thinking about our young people coming from children's social care who have care needs as well. So very happy again to note that report, and thanks to Vernon and everyone who's been involved in that. And that concludes the meeting, everyone. Thank you very much.